Asthma. Asthma is a chronic inflammatory respiratory disease which is characterized by hyperresponsiveness of tracheobronchial smooth muscle to variety stimuli of result in bronchoconstriction. It means bronchial like this, constricted. It means it will be constricted like small, and after that inflammation of that and excessive mucus inflammation. It means a swelling occurs, swelling of that occurs, and after that excessive mucus secretions will be increasing, often accompanied by the mucosal edema. It means mucus excess mucus, so that problematic situation, it called as edema. It means blocking of that, and mucosal plugging, same different term. Asthma is a chronic, it's a long term, it's an infectious, but asthma is a chronic one, a long term inflammatory conditions we can see that. And respiratory disease, it's in linked with the lung disease. Asthma is a lung disease. The symptoms like productive cough, increasing cough, means with the mucus, and it called as a wet cough, and wheezing sound, it means a sound, whistle sound. Shortness of breath occurs. Hemoptysis, it means blood in that sputum, blood will occur. After that, types are like extrinsic asthma, intrinsic asthma, status asthma. Extrinsic by the outside like that, intrinsic inside factors. After that, status, like in the status, oxygen will not be available to the lungs, so that blood in the hypoxia condition, so that is severe type of asthma where cirrhosis can be occur, like a blueness in the body is also called as in the last causes death in the status asthma. We can, in the brief, like extrinsic asthma, like causes are irritant chemicals like SO2 or something, pollen grains, frequent respiratory tract infections like in children, nasal polyps like nose nodules are non-cancerous, but and allergic rhinitis like flu or cold also can be caused that asthma. Aspirin, like by inhibiting the COX and LOX pathway, leukotrienes and the bronchoconstriction, so that it's just increasing that, and also blood vessel dilation, so that inflammation also occurs. Beta blockers also same thing, but it dilations, so the constriction inhibit the dilation, so the constriction happen. Physiology is not necessary, but easy to understand, like it's a first virus go into the body of that microphage activation, phagocytosis engulf, after that fragmentation, T cell activation of the cytotoxic reactions, interleukins production, B cell activation producing globulin E, peptide formation, agglomeration, after they destroy the sticking of the mast cell is important for the prostaglandins, histamines and leukotrienes that stop